Currently, patients in the UK are eligible for treatment on the NHS, and the NHS is really guiding us in terms of what treatment we can or cannot use in which line of therapy. So for younger, fitter patients, that is currently in induction therapy with VTD, a transplant, and then Revlimid maintenance, which is actually backed up by data that was just generated from the most recent trial reported, the Myeloma 11 trial. And then at relapse, there are different options now that patients can go down, depending on what previous treatments they had. So it becomes quite complicated immediately for the relapse therapies. The most common relapse therapy, however, is daratumumab, Velcade, and dexamethasone. And for the patients that are not fit enough for being treated with such intensive therapy as a transplant, these patients have access to either Revlimid-based therapy or Velcade-based therapy. And then again, there is a range of options depending on what they had first-line therapy as to what they can get at relapse.